Yes, these are the stats we all have been watching 24/7 in news. But is there any hope? Any good news? Well, the answer is yes. Let's look on the brighter side. Starting with China. China closes down its last coronavirus hospital as it does not have enough cases to support it. 34 cases of coronavirus were reported in China, but all these were people arriving from abroad. No domestic cases in China for the first time in the past 24 hours after 3 months of the outbreak. This scene is from China. Yes, tech giant Apple has reopened its 42 stores in China. Aged people are vulnerable, but a 103-year-old Chinese woman has recovered from coronavirus after less than a week's treatment. That is, 6 days of treatment in Wuhan. She is the oldest patient cured and discharged. She is older than another 101-year-old patient. According to local reports, Zhang did not have any underlying health conditions. She was diagnosed on March 1st and was admitted to makeshift hospital in Wuhan. Zhang was in critical condition when admitted to hospital. She had to be spoon-fed and had her diapers changed by nurses. She was given nutrition therapy. Another patient, Dai, recovered at age 98. All these cases prove that we can be hopeful even with aged people. Now about India. In India, an infected aged Italian couple with underlying lung diseases was treated and recovered using a combination of anti-malaria, HIV and flu vaccines. This is what the doctor has to say about the treatment given.
Our academic team is very strong. So the moment we came, we all had a meeting to strategize our approach to these patients, and we checked up the literature, and there was definite clue that we could use the same drug. One is oseltamivir, which we use for swine flu. We used even the Lariego, that is anti-malarial drug, and 2 of the antiviral drugs, which literature makes mention that can be very useful for corona. The bottom line was we were more interested to prevent the replication and spread of coronavirus. Our bottom line approach was that we should use some antiviral drug which could reduce the replication or fast multiplication of coronavirus.
A bit about vaccines. Coming to progress in vaccination, researchers of Erasmus Medical Center claim to have found antibody against coronavirus. San Diego Biotech Company is developing COVID-19 vaccine in collaboration with Duke University and National University of Singapore. US researchers gave first shot to a mother of 2 from Seattle. 43-year-old Mrs. Holler, the first person in a test of an experimental corona vaccine. Using IBM Summit, world's fastest supercomputer researchers ran 8,000 compounds to analyze which compounds would be effective and identified chemicals that can stop COVID-19 spread. However, all is not over. Italy took over China's toll of number of deaths, but it is due to certain factors, like it is tourists' delight which brings people here from abroad. Secondly, average age of Italians is 46 compared to countries like India having an average age of 28. Italy stated that people who died from coronavirus had a mean age of 81 and 99% of them had underlying diseases. Apart from all these good news, don't forget. That's it for the day. Stay safe, stay in.